We have some salad, some grapes.
Sylvia Leon showcases the healthy options that replace junk food in her family's home.
So these are like our little snacks that we do.
Leon says the changes came after she graduated from Project Concern International's free community health worker program. It provides wellness training to minority populations that run a higher risk of preventable diseases such as diabetes. The local initiative and similar efforts around the country are made possible by the federal government's REACH program. That stands for Racial and Ethnic Approaches to Community Health. But funding for REACH is not included in current legislation for the 2018 budget.
One of the really important reasons it matters is because there are still really wide inequities in health outcomes based on race and ethnicity.
That's Sana Shahimi from the Prevention Institute. The organization is promoting a letter to encourage lawmakers to restore REACH funding. She says REACH has a long track record of supporting programs that address harmful disparities in health.
They cause a lot of preventable suffering for the communities that experience them. And they're also very costly disparities.
Congress is expected to finalize this year's budget by December. But back in July, California Democratic Congresswoman Barbara Lee called for REACH funding to be reinstated.
Again, I hope you will really look at this and look at what this bill does, because it really wreaks havoc on people of color and communities of color in our country.
Subcommittee chairman and Oklahoma Republican Tom Cole said the problem is there isn't enough funding to go around.
But I think my friend makes a good point. But when you have a $5 billion lower allocation and you want to plus up some things that we all agree on here, because, again, nobody's asking for offsets in the areas that were plussed up.
Leon says she's disappointed that funding for the program she completed may not be restored. She says it empowered her to make simple changes on a large scale. After improving nutrition at her own home, she encouraged the parent-teacher organization at her children's school to do the same with events like birthday celebrations.
Our usuals used to be cake, ice cream, candy, cupcakes, chips, sodas. And so very easy, very cheap, very quick.
But now,
and we give them pencils, we give them notebooks and stickers and reward them that way. Fruit and veggies.
She estimates about 400 kids attend her children's school. Tarryn, Mento, KPBS News.